Flesh-eating bacteria. Introduction. Flesh-eating bacteria causes necrotizing fasciitis, which is a rare infection of the skin and tissues below it. It is a type of soft tissue infection which can destroy the tissue in your skin and muscles as well as subcutaneous tissue. It can be deadly if not treated quickly. Necrotizing fasciitis is most commonly caused by an infection with the group A Streptococcus (GAS), commonly known as flesh-eating bacteria. The scientific name is Streptococcus pyogenes. This is the fastest moving form of infection. When this infection is caused by other types of bacteria, it typically does not progress as quickly and isn't quite as dangerous. This bacterial skin infection is rare in healthy people, but it's possible to get this infection from even a tiny cut. Necrotizing fasciitis spreads quickly and aggressively in an infected person. It causes tissue death at the infection site and beyond. Cause. Several types of bacteria cause necrotizing fasciitis. The most common and well known type is group A Streptococcus. Other bacteria that can cause necrotizing fasciitis include Aeromonas hydrophila, Clostridium perfringens, Staphylococcus aureus, Klebsiella pneumoniae, E. coli. Necrotizing fasciitis happens when these type of bacteria infect the superficial fascia, a layer of connective tissue below the skin. Transmission. To get necrotizing fasciitis, you need to have the bacteria in your body. This typically occurs when the skin is broken. These injuries don't need to be large for the bacteria to take hold. The bacteria that cause necrotizing fasciitis can enter the body through surgical wounds, puncture wounds, burns, minor cuts, insect bites, abrasions, needle puncture. In some cases, it is unknown how the infection began. Once it takes hold, the infection rapidly destroys muscle, skin, and fat tissue. People who already have health issues or certain diseases that weaken the immune system are at greater risk. The greater risk for necrotizing fasciitis include those who have skin lesions, alcohol abuse, cancer, chicken pox in childhood, cirrhosis, diabetes, heart disease affecting the heart valves, chronic kidney disease, lung disease including tuberculosis, peripheral vascular disease, steroid use, use of injectable or IV drugs. Symptoms. The early symptoms of necrotizing fasciitis may not seem serious and usually appear within the first 24 hours of infection. Symptoms are similar to other conditions like the flu or a less serious skin infection. Redness and warmth around the wound or skin, those symptoms can begin at other areas of the body and you may feel as if you pulled a muscle. You may even feel like you simply have the flu-like symptoms such as diarrhea, nausea, fever, dizziness, weakness, and general malaise. The early symptoms are also similar to common post-surgical complaints such as serious pain, inflammation, intense thirst due to dehydration. You can also develop a painful red bump which is typically small. However, the red bump does not stay small. The pain will become worse and the affected area will grow quickly. There may be oozing from the infected area or it may become discolor as it decays. Blisters, bumps, black dots, or other skin lesions might appear. Symptoms often include a combination of the following: increasing pain in the general area of a skin opening, pain that is worse than what would be expected from the appearance of the cut or abrasion. More advanced symptoms happen around the painful infection site within 3 to 4 days of infection. They include swelling, possibly along with a purplish rash, large violet colored marks that turn into blisters filled with dark, spouting smell fluid, discoloration, peeling, and flakiness as tissue death, gangrene happens. Critical symptoms, which often occur within 4 to 5 days of infection, include a severe drop in blood pressure, toxic shock, unconsciousness. Other symptoms of necrotizing fasciitis include fatigue, fever with chills and sweating, vomiting, infrequent urination. Serious complications are common and may include sepsis, shock, organ failure, loss of an arm or leg due to amputation, severe scarring, death. Diagnosis. Flesh eating bacteria necrotizing fasciitis affects the body quickly, making early diagnosis important to survival. The doctor will examine you and review your symptoms. Having flesh eating bacteria is a medical emergency, and if a doctor suspects you may have it, you'll likely be admitted to a hospital and get tested there. In addition to looking at your skin, your doctor may perform several tests to diagnose this condition. Blood tests, CT, or MRI scans may help your doctor make a diagnosis. Household members and others who have had close contact with someone with necrotizing fasciitis should be tested for the disease if they have the symptoms of an infection. Blood tests. Infection causes high levels of white blood cells and it can show if your muscles have been damaged. Tissue biopsy. A small sample of the affected skin tissue is obtained via surgery for examination. The tissue is sent to the lab to identify the particular bacteria that's causing the infection. You'll be given some medicine to treat the infection before test results are back. CT scan. A CT scan can show your doctor where fluid and pus are collecting in the body. It can also show the presence of gas bubbles under the skin, which helps confirm the diagnosis. Treatment. Patients infected with flesh eating bacteria will undergo several types of treatment. The extent of treatment depends upon the stage of the disease when treatment is started. The treatment includes intravenous antibiotic therapy, surgery to remove damaged or dead tissue in order to stop the spread of infection, medication to raise blood pressure, amputation of affected limbs in some cases. Hyperbaric oxygen therapy may be recommended to preserve healthy tissue, cardiac monitoring and breathing aids, blood transfusions, intravenous immunoglobulin. This supports the body's ability to fight infection. Outlook. The outlook depends entirely on the severity of the condition. Each case is unique. Early diagnosis is crucial for this dangerous, life threatening infection. The earlier the infection is diagnosed, the earlier it can be treated. Without prompt treatment, this infection can be fatal. Other conditions that you have in addition to the infection can also have an impact on the outlook. Many people need more than one procedure to remove damaged infected tissue. If you have red swollen skin and it is not going away, make an appointment with your doctor. Those who recover from necrotizing fasciitis may experience anything from minor scarring to limb amputation. It may require multiple surgical procedures to treat and then additional procedures such as delayed wound closure or skin grafting. Prevention. You can reduce your risk with basic hygiene practices. Wash your hands frequently with soap and water or using an alcohol hand sanitizer is one of the best steps you can take to prevent flesh-eating bacteria and other skin infection. Treat any wounds promptly, even minor ones. Change your bandages regularly or when they become wet or dirty. Hot tubs, whirlpools, and swimming pools should be avoided when you have a wound. Go to your doctor or the emergency room immediately if you have a serious or deep wound or if you think there is any chance you may have necrotizing fasciitis. Treating the infection early is very important to avoid complication. You can also prevent skin infection by taking these steps. Always clean cuts and open wounds with soap and water. After cleaning, cover an oozing, draining, or open wound with a clean, dry bandage. There is no vaccine available to prevent flesh-eating bacteria infection.